So you go in for what's supposed to be a routine surgery, but then something goes wrong. An emergency procedure saves your life, which is incredible. But then you get hit with a bill you never saw coming. How does that even happen? And more importantly, is there a way to prevent it? That's what we're going to get into, this really complex world of medical complications and what it all means for patients.
Okay, so before we dive in, I have to make something super clear. The story we're about to walk through is hypothetical. It is not a real case. But it's designed to highlight a really common and tricky problem that patients can and do run into.
So let's set the scene. Our story starts with a diagnosis that completely changes a woman's life and sends her down a path she could have never, ever predicted.
Okay, picture this. We have a 58-year-old woman who, after 3 long months of abdominal pain, finally gets an answer. It's a malignant ovarian tumor. The next step is an operation to remove it. But during the procedure, there's a serious complication. The surgeon accidentally punctures her aorta, which is, a huge deal. An emergency vascular surgeon has to be called in. Luckily, they save her life. So after she recovers, you can just imagine the relief, right? But then she gets a bill, a surprise bill for that second surgeon's services. And suddenly she's left wondering, wait, how is this my responsibility?
This story, even though it's made up, really gets to the heart of a major issue in healthcare, doesn't it? It makes us all stop and ask a pretty tough question about how we're supposed to handle things when they don't go according to plan.
Which leads to the big question. How could something like this be avoided? I'm not just talking about the medical complication itself, but the whole mess that comes after, the surprise bills, the confusion, the stress. What could have been done differently here?
Well, here's the thing we have to remember. Surgical procedures are, at the end of the day, a human endeavor. They're not performed by robots. And because people are involved, there's always a chance for unwanted complications. The goal isn't to pretend we can eliminate every single risk. That's just not realistic. The real goal is to figure out how to manage those risks, and that means being honest and clear about them from the start.
And the most powerful tool for managing all this, it's not some fancy new piece of medical tech or a high-tech scalpel. It's actually a principle, an idea that's right at the core of medical ethics.
This principle is called free and informed consent. And what does that actually mean? Well, think of it this way. It's the process where you, the patient, get all the essential information you need. That includes what could go wrong, any potential complications, and, even the costs that might pop up. The key here is that you're not just handed a pamphlet. You need to really understand it all so you can freely make a decision about your own care.
Okay, so we have this great principle. But just having a rule isn't enough, right? How it's actually put into practice is what really matters. And it turns out there are 2 totally different ways to go about it.
Let's break down these 2 approaches. First, you've got what's called the legalistic approach. This is probably what you're imagining. Stacks of forms, checklists, making sure every single detail is documented and signed. It can get tedious, and its main goal is really to protect the hospital from lawsuits. But then there's the relational approach. This one is completely different. It's not about the paperwork. It's about building an actual relationship between the medical team and the patient. It's about trust.
And that right there, that's the key difference. The real power isn't in the signed forms, it's in that partnership. The whole goal shifts from just trying to avoid getting sued to building something that's actually way more protective for everybody involved.
Think about what happens when that trust is there. The patient gets it. They understand that even the best surgeons can run into complications because medicine is complex. A problem isn't automatically someone's fault. It's a challenge you face together. And honestly, that strong relationship can end up being way more protective for everyone than a pile of meticulous documents ever could be.
There's a quote that just sums this up perfectly. It says, "In the unfortunate event of inadvertence or error, the patient will easily excuse the doctor who strives to provide the best possible care." And that's it, right? When you have that foundation of trust, when you really believe your doctor is doing everything they can for you, it changes everything. You're not adversaries, you're on the same team.
So it all comes down to this one question, really. In this incredibly complex, high-stakes world of medicine, what is it that truly protects a patient? Is it a signature on a line, or is it a real human relationship built on a foundation of trust? Something to think about for sure.